So, what if the future of your healthcare wasn't decided in some far-off boardroom, but by the actual people living in your own neighborhood? Today, we're going to dig into a really interesting new blueprint coming out of the UK, where the NHS is partnering up with local community groups to basically reshape healthcare from the ground up. Let's dive in and see how it all works. But before we get into the weeds, let me ask you something. How much say do you think local charities and community groups really have when it comes to your healthcare? You might think, well, probably not much. But a huge shift is happening right now that could put them right at the center of the whole decision-making process. So what is this big change all about? Well, NHS England has rolled out a new framework that isn't just some small adjustment. No, this is designed to fundamentally rewire how local healthcare is even organized. Let's unpack the main idea that's driving this whole thing. Okay, at the heart of this new model is a concept called strategic commissioning. And I know it sounds like a classic corporate buzzword, right? But the idea behind it is actually pretty powerful. Instead of just reacting when people get sick, the local NHS bodies, they're called ICBs, are now tasked with proactively planning and funding services that improve the health of the entire community and, crucially, reduce inequality. You can really think of it as a shift from a sick care system to a true healthcare system. And this isn't just some vague mission statement. It's a really structured four-stage cycle. As you can see, it all kicks off with understanding the context of a community. What's really going on? From there, a long-term strategy gets developed. Then comes the delivery, putting the money and resources into the right services. And finally, and this is so important, that fourth step, evaluating the impact to see what actually worked. Keep these four stages in your head because they're basically the backbone of this entire plan. All right, so who are the key players making all this happen? Well, this new approach really depends on a partnership between two very different kinds of organizations. On one side, you've got the VCSE Alliance. Now that stands for the Voluntary, Community, and Social Enterprise sector. Just think of them as the grassroots organizations, the local charities, the food banks, the neighborhood support groups, the people who are on the front lines and really get the real-world needs of their communities. And then on the other side, you have the ICB, the Integrated Care Board. These are the official NHS planners, the ones holding the purse strings and drawing up the big plan. And this partnership didn't just pop up overnight. It's actually been building for a while. This timeline shows that back in July, the ICB officially approved a framework to work with these community groups. Then fast forward to December, and the ICB's CEO personally invited the Alliance to take a leading role in shaping the final strategy. You can see it's a clear move towards a much, much deeper collaboration. So, why does all this matter? What's the big deal about bringing community groups into these high-level official planning meetings? Well, it all comes down to a pretty radical shift in perspective, and it's captured by three simple but really powerful guiding principles. The first principle is being person-centered. This quote just nails it. I need a service that understands what's important to me, not just which bits of me have problems. It's all about shifting the focus from just a clinical checklist of symptoms to understanding the whole person, their life, their goals, and what they actually need to live well. Okay, the second principle is being community-focused. This gets at a fundamental truth. Health isn't just created in a doctor's office or hospital. It's built in our neighborhoods, in our parks, our community centers. The whole goal is to build communities that are naturally healthy and supportive, so people only have to turn to those specialist services when it's absolutely necessary. And the third, and honestly this might be the most important one, is focusing on preventative impact. The logic here is so simple but so profound. The best sign of success is the crisis that never happens. It's about shifting money and effort upstream to keep people healthy and well in the first place, instead of only spending a fortune to pick up the pieces after things go wrong. Okay, so principles are great, but let's be real. How do you actually turn them into action? This is where the VCSE Alliance's action plan comes in. So let's walk through how they're proposing to weave these principles into each of those four stages of the commissioning cycle we talked about earlier. Let's start back at stage one, understanding the context. Because, to solve a problem, you have to see it clearly first. This is all about getting the most accurate, ground-level picture of what a community really needs. Right now, community groups share their data with the NHS. That's a good start, but it's often a bit of a one-way street. The proposed next step is a total game changer, embedding an expert from the community sector directly into the NHS team that analyzes all this data. This takes them from just being a source of information to being a core partner in actually figuring out what it all means. All right, now for stage two. Once you have that deep understanding of what the community needs, the next step is to turn all those insights into a solid, long-term health strategy. The Alliance already has over 50 ambassadors sitting in various NHS working groups, which is a fantastic foundation. But the vision here is to expand that, to make sure a community advocate has a seat at the table in every single strategic planning group. That would guarantee that those three guiding principles, person-centered, community-focused, and preventative, are baked into every decision, not just some of them. Next up is stage 3, and this is really where the rubber meets the road. We're talking about money, how it's spent, and which services actually get funded. Right now, the way funding and contracts work can be incredibly complicated, and that often locks out smaller, grassroots community groups. So the Alliance's proposal is to basically tear up the old rulebook and co-create brand new, simpler guidance for how these things work. This would make it so much easier for all kinds of diverse and specialized local groups to partner with the NHS, unlocking a whole wave of really innovative local solutions. And finally, we're at stage 4, evaluating impact. After all this planning and spending, how do you actually know if you're making a difference? How do you know if you're really improving people's lives? At the moment, community feedback is part of the evaluation process, but the plan is to go so much deeper. First, by putting community data scientists right inside the official NHS evaluation teams. And maybe even more importantly, by commissioning evaluations that are designed and delivered with the people who have actually used the services. This isn't just about measuring data points on a spreadsheet. It's about measuring what truly matters to people. So when you take a step back and look at the whole picture, from really understanding a community's needs all the way to measuring what truly matters to them, this isn't just a new plan. It feels more like a blueprint for a completely different kind of healthcare system. And it leaves us with one massive question. Could this kind of deep partnership between the official system and the grassroots community be the key to unlocking a healthier future for all of us?